Good morning, good afternoon, colleagues in your respective time zones. My name is Charles Katende. I'm the Chief of Policy, Strategic Information and Planning in the Policy and Strategy Division at UNFPA. My role today is to moderate this webinar about SRH, Sexual and Reproductive Health, programming in response to the COVID-19 crisis. I'm sure you're all busy working and responding to the crisis. There are so many challenges, and we are looking for experiences about how to go about this business, which is a new way of doing business in this crisis. So we are very honored today to have colleagues who have been doing this hands-on in China, where this crisis has been there for some time, since maybe December. Today's experience is going to be very important because it enables us to really get informed and adjust our responses as we proceed to respond to this emergency in the countries where it is actually now in its initial stages. We have a distinguished panel of about 7 speakers, so bear with me, but we'll go through it, trust me. Some of them will give remarks, others will make presentations about their experiences in dealing with the SRH in this COVID-19 pandemic crisis. First, we'll have Dr. Ramiz Arapbarov, the Deputy Executive Director and Chair of the UNFPA Crisis Response Team. Dr. Ramiz will give opening remarks. And then we'll have remarks from Mr. Adenene Ben Haj Aissa, the Executive Director of Partnership in Population and Development. We'll have remarks from Ms. Zhang Yang, Director General, National Health Commission of China. And then we'll proceed to presentations of the experiences by Dr. Song Li, the Deputy Director General, Department of Maternal and Child Health, National Health Commission, China. We'll have Dr. Chao Ji, member of Chinese Academy of Engineering and President of Peking University Third Hospital in China. We'll have Dr. Zheng Linhong, Chief Physician, Neonatal Medicine Department, Wuhan Children's Hospital in China. And then we'll have a discussion from a colleague from UNFPA, Ms. Aneka Carlson. So it is an exciting moment, and we're looking forward to really hearing and sharing of the experience of our colleagues. Please, you are requested, you are all muted because we would like that if you have any question, you enter it into the chat box. That way, because of the big numbers, we can manage the webinar much better. At the end of the presentations and the discussions, or discussant, we'll have a Q&A session, and we'll be looking into the chat room to pick the questions so that our panelists can respond to them. All right. And then to our panelists, those of you giving remarks, please keep it for about 3 minutes. I'm sorry for the short time, and those presenting their experiences, we would like you to do it in 10 minutes. That way we can keep time and be able to conclude by 9:30 New York time. So I don't want to be to waste more time. So I will invite Dr. Ramiz Arapbarov to give us the opening remarks and contextualize this webinar. Dr. Ramiz.
Thank you very much. Can you hear me?
Yes.
Yes.
Thank you. Distinguished participants, colleagues, friends from all over the world, I'm so honored today to be able to open this webinar and discussion, and first of all express my deep appreciation and warm welcome to the discussion to Ms. Zhang Yang, Director General of National Health Commission of China. Thank you very much for making this experience sharing possible, and for your team to agree and to share your first-hand experience, which is very useful and very timely for the entire world, given the unfolding impact of the COVID-19 and especially of pregnant women. I also express thanks to Dr. Adnan bin Haj Al Aissa, of the Partners in Population and Development, for the facilitation and making this possible. As you know, this webinar is organized as part of the partnership, South-South Cooperation Partnership between National Health Commission of China, Partners in Population and Development, and of UNFPA. The COVID pandemic is the largest public health crisis. We all know, we're all seeing what is happening. And our particular focus today, how this is affecting pregnant women and newborns, and how it may evolve as we learn more about the pandemic. In our work on the ground, UNFPA prioritizes all the support to countries with weaker public health and social support systems, including those countries which experience humanitarian situations. Our focus predominantly is on uninterrupted supplies of modern contraceptives, providing sexual reproductive health services and rights, making sure that health systems are strengthened, and we focus on protection of healthcare providers, delivering antenatal and postnatal services, and ensuring safe deliveries of babies. This includes procurement and distribution of personal protection equipment and information and training on hygiene and infection control. Of course, another important dimension during this time is addressing the sexual and gender-based violence issues, which sometimes at time of crisis increases. We need to focus on all these three priorities. The devastating impact of the coronavirus will be augmented by an increase in maternal mortality, teenage pregnancies, gender-based violence, and all other forms of suffering which women and young girls experience. We know that there is no scientific evidence about the increased susceptibility of pregnant women to COVID-19 and vertical mother-to-child transmission of COVID, but some anecdotal evidences we hear. We are also closely watching the development of science, and we do know already that pregnant women with respiratory illness may be treated with utmost priority due to the increased risk of adverse outcomes. It's an opportunity for us today to be together to discuss this, and I'm very grateful that our Chinese frontliners, those who have responded first to the epidemics, are now gathering strong and sharing their experiences. This is an amazing example. We look forward to work more with our partners in China in learning from their experiences and also in helping other countries. Thank you very much for making this South-South exchange possible and sharing with us your actionable knowledge on this important topic, and look forward to continue to work with you closely as we respond all together to the crisis. Thank you very much again, and over to facilitator. Thank you, Charles.
Thank you, Dr. Mizarak Barov, for your opening remarks and the contextualizing this webinar. Indeed, as you have mentioned, this is we are very grateful to our colleagues from China to be able to share their experiences. Let me now call upon Mr. Adnan bin Haj Aissa, the Executive Director of Partners in Population and Development, for his remarks.
Good evening from PPD in Dhaka, Bangladesh. And thank you all for joining our webinar. We believe you are very busy with the fight against COVID-19 pandemic and trying hard to stop the spread of the virus and save lives in your respective countries. As you are aware, the world is facing the most challenging crisis never happened in our time and faced by our generation. The COVID-19 is hitting more than 200 countries and territories, killing around 40,000 people so far. And the spread will continue if strict and steadfast preventive measures are not undertaken. Today, we are going to learn the successful experience of China. I would like to thank the National Health Commission, Ms. Hang Yang, and all the team in facilitating this webinar. And we are focusing particularly on pregnant women and newborns, implemented by the frontline health workforce under the inspiring leadership that brought the pandemic to zero local infection. China's means and methods were impressive, and gave the world a message of hope. It shows that the outbreak is preventable and can be controllable. Sexual and reproductive health response, while combating the COVID-19, has also been dealt with as an essential component of this fight. In this global effort, PPD, as an intergovernmental organization of 27 developing countries from different continents and representing more than 60% of the world population, is contributing through South-South cooperation to share best practices, particularly from China, to fight against the virus. PPD board chaired by China through National Health Commission and led by Her Excellency Dr. Libin, and grouping ministers of health, planning, finance, and social development, is very much concerned with emerging health and population issues, including COVID-19, which has infected more than 94,000 people so far in PPD member states, and around 3,700 lost their lives in PPD member states. China stood by several PPD member states to assist in fighting the virus, sharing the prevention and treatment protocols, which you can find in our PPD website. And also China granted personal equipment and sending experts. Bangladesh, Pakistan, Tunisia, Indonesia, and many other countries have benefited from the Chinese technical assistance in tackling the COVID-19, which demonstrated an extraordinary model for South-South and also South-North cooperation, since China also assisted Italy in fighting the COVID-19. And in recognition of its continuous support to PPD member states, the Egyptian Health Minister, Madame Hala Zaid, flew to Beijing on early March 20 to convey Egypt's solidarity and support to China in combating the virus. I think we are a best example of collaboration and solidarity. Friends and colleagues, PPD is making a global call for heightened solidarity, intensive coordination, and accelerated South-South cooperation, since they are the best means to defeat this pandemic. We strongly believe that combating this virus can be done only through collective efforts, strengthened cooperation, and coordinated response. A global health issue can't be treated individually, and COVID-19 brought all countries at the same alignment. We must face this enemy together, united and stronger. This webinar will highlight challenges and concerns of UNFPA country programs and PPD member states in facing COVID-19 crisis. Chinese doctors and experts will share their experience with their counterparts from other countries, specifically on keeping pregnancy and fetus healthy during the pandemic. We wish that the webinar will build a network with different partners and experts to continue online sharing of best practices under these restrictions of movement and gatherings. And I must thank UNFPA for the initiative, the National Health Commission for the response, and also PPD member countries for their continued support. I will stop here my intervention, since we are going to listen from the Chinese experts and documents, and let me conclude my statement. Thank you all, and thank you, Charles, for coordinating and also facilitating this webinar. Thank you all.
Thank you, Mr. Adelini, for those insightful remarks. And then you also thank the partners in cooperation and development for working with the UNFPA to organize this webinar. As you have contextualized, this is the experience we are all yearning for, to see how we can learn from what has happened in China and possibly manage our situation that we're in right now.
Yes, actually, I come to Wuhan from the February 1st and leading 3 Peking University hospital. My aim is to establish the severe ward for saved severe patients. At that time, you all know, as Wuhan also have a serious condition. And at that time, we do the different work, and for the mild patient, for the mobile hotel like Fangcang Hospital, and also changing some the high-level hospital to the severe like Tongji Hospital. And after finish that work, I focus on the maternal and infant safetiness for the hotspot, because during this outbreak of COVID-19, and we questioned some pregnant women, and OB specialist found out some major concern for those uninfected patient. They of course have a great concern about the infection risk, especially during the routine check, the risk expose an infection at the community, and during routine check out and prenatal checkout schedule, and what is necessary or can be reduced or removed, and also the safety delivery, how to avoid transmission in the hospital. And actually, for the reducing the risk of expose and infection for the infected pregnant woman, of course, prevention procedure is very, very important for the home quarantine, avoid close contact. And actually, in Wuhan, a few pregnant women infected just because they do a good job for the wear mask and wash hands, and also sanitate the rooms, and also we give some suggestion for their self-monitoring adverse symptoms related to the COVID-19. And for prenatal checkup recommendation, pregnant women should know the contents and the interval of prenatal checkups, like a fetal heart occlusion at home replace checkout is not recommended, but the others can, the online approach should be encouraged to provide the health education and counseling for pregnant women. Most of our obstetricians give the free consult online, so help a lot of unaffected pregnant women. Actually, on the 28 gestational weeks with no discomfortable, check can be extended approximately and monitor the fetal movements and symptoms at home. And after 28 gestational weeks preceding the regular checkup as recommended. And high-risk patients should go to every scheduled checkups. And for the uninfected, the safety delivery, routine screening, we have to do the epidemic history, like have a contact history for the COVID-19 patient, need to be moved to the suspected patients. So like the sign and symptoms and antibodies, and for the families, if positive, isolated immediately. And the safety distance between patients also is very, very important. Actually, I give the picture for the Wuhan Women Children's Hospital. Actually, per day, they delivery 73 pregnant woman delivery average. So actually, it's really crowded. So avoid crowded and less patient in one room, consult and in hospital, and also delivery, all important to need to give enough space for the safety. And also try to shelter hospital stay and give the patient education for the postpartum care, especially protection, and also following the infection control orders strictly for hospital. And for already infected, the situation infected pregnant in women, that's I have do the survey for the Wuhan city. We got more than 100 cases confirmed, and whole China we also do the survey. And until now, about also just less than 200 cases confirmed, and most of them is the mild cases, less than 10%. I remember nearly 7% that we just submit to the New England Journal of Medicine, and to try to analyze the condition of this kind of patient, and just have a patient there. And for the infected situation for the situation of infected women, for suspected or confirmed pregnant women, it is suggested to go to the designated midwifery medical institution for treatments as soon as possible. We already have 1,654 designated hospitals provided medical service for infected women in China. And of course, the screening for suspected patient and management if infected during the first or second or third trimester, and also the concern about the choice of delivery mode, vaginal delivery or cesarean section, and also postpartum care and protection of neonates, and how to protect the medical staff also is very, very important things. During the admission, screening for infected is also important for the epidemiology screening, and also like fever, cough, short breath, diarrhea, fatigues, and this is kind of sign and symptom have been recorded, and also blood test for the CBC, and if necessary, we like the woman take the nucleic acid or CT scan. Actually, in Wuhan, CT scan is important because it can quickly get it at that time. And because the beginning, the nucleic acid is not easy to get immediately, usually 4 days, 3 days. So CT scan at the beginning in Wuhan for the delivery patient before admission, we do the CT scan. And if suspected, the quarantine the patient in special room as soon as possible should be, and also including the MDT consults is important. And for the treatment recommendation, the suspected and infected patient should be quarantined to isolated women immediately, and also until now, no evidence support the termination of pregnant without medical indication. And for the treatment recommendation, the pregnant woman with severe or critical COVID-19 should be terminated pregnancy, and the best choice is cesarean section. That means if the mild COVID-19 pneumonia, just waiting for and observe and give them oxygen and the other treatment, but if the severe and critical COVID-19 should be terminated pregnancy, and the best choice is cesarean section. And also need to pay more attention for the after delivery, because postpartum, some patient will become severe. And whether there is a vertical transmission from mother to baby, and for the 0.1 is yes, because some report from JAMA healthy the mother was suffering from coronavirus. The antibody of SARS-CoV-2 IgM was increased, and the cytokine test was abnormal. I continue to present transmit from the mother to the children, to the babies. There's many people concerned about that. And the point one is yes, because the JAMA published 2 papers. One is the mother was suffer from coronavirus, the antibody of SARS-CoV-2 IgM was increased, and the cytokine test was normal in the newborn 2 hours after birth. All it is a 2 paper from the others is the 2 newborn IgM as positive, because as you know, the IgM cannot pass the placenta, so they think this kind of IgM is produced by the baby, so that means got the virus infection from the mother, so can have the IgM. But also have another one report from the neonatal. They report one case neonatal infection, also in Wuhan, another hospital, for the SWOT test, nucleic acid positive. But this case I know is after birth 26 hours. The news told is 30 hours, and I consulted as the 36 hours, and also have contacted other people. So this cases as a transmission or the other people give them is not very, very clear. And the other research show is not sure. This is from the Zhongnan Hospital. They tested the babies, non-pregnant women, and 6 newborn have tested the nucleic acid, and also amnioflor and cord blood and breast milk, and also the neonatal throat swab sample, all as negative. And I already take the data from the Wuhan 51 hospital is designated. The hospital take the COVID-19 patients, nearly 100 neonatal test is negative for the throat swab sample for nucleic acid. So actually, until now, is not sure. Is another point for this, because you know the neonatal COVID-19 nucleic acid test is more be confirmed, and the IgM acid can be prone to false positive and false negative results. It's not stable until now, and rapid decline report in the patient present also is not be confirmed. So for the SARS-CoV-2 be transmitted in uterus, yes or no, need more definitive evidence. We already have the project to continue to follow some pregnant women as midterm, second term, or the early third term, and we're waiting for the result. Hope give the more evidence and can support it, but until now, no strong evidence can confirm the vertical transmission. And for the infected woman, the infection prevention risk during vaginal birth caused the decreasing body resistance due to the physical exhaust during labor, and also increasing infection prevention and control difficulty due to the hyperventilation, amnioflow, vaginal bleeding, or vaginal discharge. Even now, this kind of search is negative. And also most patient and OB/GYN doctor selected the cesarean section and of the termination the pregnant. And if emergency cesarean section needed, infection prevention procedure had to implant rapidly, and so Also, that's another reason. And for the delivery and postpartum recommendation, and labor and delivery should be performed in a designated negative pressure isolation room and managed by designed personnel with specialized and infection control prepare and protection protective gears. That's very important, the protect for the medical staff. And neonate of mothers with COVID-19 should not be breastfed until the mother's isolation period is complete. And also neonates of mothers with COVID-19 should be isolated in a designated unit for at least 14 days after birth. And some people want to breast, but compare the risk for breeding or the newborn infection. We also suggest at least 14 days after birth is isolated. And maternal and neonatal follow-up should be done to evaluate their safety and health. And because the time limited, we just introduced some practice in China for the isolation catalog of pregnant women. That's the picture. As first for the regular prenatal examination, home isolation is important. And for Fangchang shelter and hospital, continue.
Yes.
For the suspected cases, for the normal pregnant woman, home isolated, that's okay. And regular prenatal examination, most can be the online, and the special times should be go to the hospital. And for the suspected cases or confirm the mild cases, like Fangchang Shelter Hospital or obstetric gynecology general hospital, also is okay, but need to isolate the sources of infection, and also should be cut off transmission route and close observation of patients, because this kind of patient, even is mild, maybe become the severe. And I heard some patient from Iran as a series and died 6 pregnant women. It's the second trimester or third trimester. And in Wuhan, we are lucky, no pregnant woman because the COVID-19 died. All is safe, and already have a delivery 68 women is safety. But for the confirmed severe cases, should be go to the designated hospital and managed by the national medical specialist team here. That means high quality can let a patient get the good treatment. And for the emergency plan and infection control procedure, we should be prepare for the cesarean section, contingency plan, and delivery management. Prepare before the operation, and actually prepare for our. And for the post-delivery, the sample collection need to prepare first, because there's a very limited for the transmission. This kind of blood and amnio flow all need be strict control for the research. And for emergency delivery, have a procedure. And prevention drill, regardless of delivery mode, I already present. Actually here, I just want to emphasize need for the severe patient need to emergency cesarean section, or in lab need to active cesarean section procedure, and infection control is crucial. So drill is important, regardless of delivery mode, need to pretension. And another thing, I just a little time for the psychological intervention, because psychological intervention and support is very important. That kind of special condition for pregnant women during the outbreak of COVID-19. And the sample already present for the 2002 pregnant women from the 193 community health center and 67 hospitals. This research, they used the questionnaire, find actually 94% pregnant women worry about being infected, and 14% demanded for the psychology consultant, and 71% would like to obtain knowledge and consultations through the online apps. So the critical issue, the final slides, the critical issue for protecting pregnant women as 4E. 4E means early identification, early reporting, early isolation, and early treatment is very, very important. Another is 4P, protection of pregnant women, protection of family members, protection of health workers, and protection of hospital. All is very, very important, because in China, the decision by the central leadership and General President Xi Jinping also come to Wuhan. I'm one of the 10 doctors nearly the President Xi, and also our Vice Premier Sun Chunlan, also in Wuhan. We have several times discussing about the situation and how to management is always important, and PRA soldiers also help us a lot. And we have the national policy and technical guideline and optimizing operation of MCH service system. The overall arrangement is important, can get the nationals war on epidemics. And now there's I think it's the last week I working in Wuhan, and only a few people suffered severe disease in the Wuhan now for COVID-19 pneumonia. So we already arrangement back to Beijing, and as you know, many medical staff already back to the other province. At that time, we have 41,000 medical staff working in Wuhan from whole China, and that means miles apart but close at heart. Here I also pray, and we whole world we can union and working together and fighting the COVID-19. Thank you for share.
Thank you, Dr. Shaolin Jing. Colleagues, I think you can agree with me. This is a moving presentation. The experience is overwhelming. I will not forget the 4 E's and 4 P's. Thank you so much and we congratulations for really, making all this progress and for sharing the experience. So
yeah, I will share the PPT for everybody. Yeah.
Yes,
here.
And the PowerPoint will be shared. So we don't have much time. So I will proceed now to Dr. Song Lee. I understand Dr. Song Lee, you are ready to present. So Dr. Song Lee is the Deputy Director General of the Department of Maternal and Child Health at the National Health Commission in China. Dr. Song Lee, you have the floor.
Okay, ladies and gentlemen, dear friends, thanks for inviting me to this conference. It's my honor to share some experience learned from China in response to the COVID-19 outbreak, especially on ensuring the safety and the health of pregnant women and newborns. I have some slides now. The second slide, okay, please. Okay, the Chinese government has always attached great importance to the safety of mothers and infants and adhered to the principle of giving priority to children and ensuring the safety of mothers. Since the beginning of immediate response to the outbreak, pregnant women and children were among the priorities of government response plan, and a series of policies and standards for protecting, preventing, and treating pregnant women and children have been released in a timely manner. The third slide. The overall approaches of the government response with regard to pregnant women and children could be summarized as 3 key points. First, timely releasing national policies and technical guidelines on COVID-19 prevention and management among pregnant women and children. Second, optimizing the operation of MCH service system to adapt the changing situation during the outbreak. Third, strengthening provision of maternal and child health services through different channels and platforms. I will elaborate a bit about the 3 approaches in the rest of my speech. And just a moment ago, our Professor Qiao Jie have given you some more technical details, and later another Professor Zheng Lingkong from Wuhan Children's Hospital will give you more details about the newborns protection. So the fourth slide, okay. The first, timely release national policies and technical guidelines on COVID-19 prevention and management among pregnant women and children. Upon review of epidemic of COVID-19 across the country and existing evidence on the risk action among pregnant women and children, national policies and technical guidelines were developed and issued, which including notice on how to prevent and manage infected pregnant women and children during the outbreak of COVID-19, and notice on strengthening management of pregnant women and ensuring safety of motherhood during the outbreak of COVID-19. If you need, we can organize experts to translate into English the whole notice content later. Okay. The notice released by the central government provided timely guidance to local health authorities and service providers on how to ensure the provision of quality care to targeted population through multi-sectoral coordination, human resource reallocation, and supply management. During the epidemic, National Health Commission worked closely with national expert teams to reveal up-to-date evidence, summarize experience generated from the frontline health facilities, and include them into national diagnosis and treatment protocols, which including symptoms of COVID-19 infection, recommended treatment, and mode of delivery for pregnant women with COVID-19 infection. Just a moment ago, Professor Qiao Jie have introduced some details to you. Also, a series of clinical guidelines were released by different medical associations to provide technical support to frontline practitioners. Meanwhile, messages on precaution measures targeting on general population were distributed through press release and various communication channels. The 5th slide, please. So, the second, optimize the operation of MCH service system to adapt the changing situation during the outbreak. Based on experience generated across the country over the last few years, strategy to ensure maternal and infant safety was developed and released by the central government, which including 5 key approaches, which were screening and assessment of risk of pregnancy, systematic management of high-risk pregnant women, management of near-miss pregnancies, case and case reporting of individual maternal deaths, and accountability of maternal and infant safety. The 6th slide, please. So the strategy highlighted the importance of screening and assessment of high-risk pregnancies as early as possible during pregnancy, and emphasized the importance of applying differentiated management approaches to pregnant women with different risks of pregnancy. For high-risk pregnant women, systematic management throughout the pregnancy is required, and additional life-saving measures need to be in place for near-miss pregnancies. Through this strategy, the working mechanism is in place to ensure timely provision of quality care for pregnant women under different situations. The 7th slide, please. During the outbreak of COVID-19, we further optimized the operation of MCH system so that the fast-changing situation during the outbreak is well adapted and more targeted services were provided to pregnant women and newborns. For low-risk pregnant women, they were advised to adjust their schedule for antenatal care visits and consult with their doctors on how to protect themselves and conduct health monitoring at home. For pregnant women with complications, suggestions were provided on how to conduct antenatal care visits as scheduled and under what situation they should go to hospitals. For pregnant women with confirmed COVID-19 infection, all should follow the protocol of management of pregnant women with infectious disease. The 8th slide, please. In order to ensure timely detection and treatment of infected pregnant women, a service provision system for screening, diagnosis, and treatment of pregnant women with COVID-19 was established based on the existing MCH system. Across the country, fever clinics were established in health facilities which have good capacity and are providing delivery services, and a set of health facilities with strong comprehensive treatment capabilities and providing delivery services were identified as designated hospitals for pregnant women. The list of hospitals with fever clinics and designated for receiving pregnant women were released to the public on websites. All health facilities providing delivery services have established pre-screening and triage mechanisms so that pregnant women with fever could receive screening service in fever clinics. Pregnant women with confirmed infection could be referred to designated hospitals for COVID-19 treatment, and others could receive routine antenatal care service as needed. Through this service provision system, the roles and responsibilities of different sectors and hospitals were clarified, and the referral mechanisms of confirmed cases were established so that pregnant women and different situations could receive targeted services, and life-saving services could be provided in a timely manner. The next slide, please. Third, strengthening provision of maternal and child health services through different channels and platforms in response to the physical and psychological characteristics of pregnant women during the outbreak of COVID-19. Health facilities were required to provide more support on antenatal care and mental health, which were done through various channels, such as online consultation, WeChat, and other social media, APP, hotline, and videos. The 10th slide, please. Health facilities were requested to set up separate routes for antenatal care clinics and obstetric wards so as to minimize the risk of infection of pregnant women. Expert groups composed of obstetricians, pediatricians, physicians specialized in respiratory, infectious disease, and ICU were established in all areas across the country. and they participated the management of near-miss pregnancies with COVID-19 infection. For newborns of women with confirmed infection, isolation and specific newborn care were required, and newborns under severe condition were requested to be referred to designated hospitals for further treatment. Later, our Professor Zheng Lingkong from Wuhan will give you more detail about newborn safety. The prevention and control measures described above have been tested in practice and effectively protected the health of pregnant women and newborns in China. Currently, COVID-19 is spreading all over the world. The 11th, in the G20 summit held last week, President Xi Jinping stressed that at such a moment, it is imperative for the international community to strengthen confidence, act with unity, and work together in a collective response to the outbreak. So, we are willing to share our experience with international community, exchange effective measures to ensure the health of pregnant women and children, and contribute to the fight against the COVID-19 pandemic globally. Thank you.
Thank you very much, Dr. Song Lee. That was very wonderful. The experience you are sharing, definitely I can see you had to devise with so many means to manage the situations. We don't have much more time, so I'll call upon Dr. Zheng Lingkong, the Chief Physician, Neonatal Medicine Department, Wuhan Children's Hospital, to share the experience. Dr. Zheng, you have the floor.
Ladies and gentlemen, it's an honor to be here to share our experience of neonatal treatment of COVID-19 in this outbreak in China. The goal of my presentation is to learn from neonatals with COVID-19 and to share what we do in China. As we all know, the 2019 COVID-19 disease have been declared a global pandemic, and the new data today is more than 800,000, in fact, caused about 40,000 deaths. With the sharp increase in the number of infections, the number of pregnant women and neonatal with COVID-19 is also on the rise. Our hospital, Wuhan Children's Hospital, was designated by the government as the only treatment center of neonatal COVID-19 patients and neonatals born to mother with COVID-19. The first case infected neonatal was reported, and this first case was treated successfully, recovered, and was discharged from our hospital. Next, with my experience in our hospital, and I would like to talk about the COVID infected in neonatal in the following 4 aspects. First, I will talk about the routine of transmission in the newborn. So far, there are 3 late onset infected newborns where the familial aggregation infection. Those newborn were healthy after birth and had clear history of postnatal close contact with infected caregiver. And about the vertical transmission, Dr. Chow had talked about it. I will skip it. Part 2, secondary, I will talk about the clinical characteristics and diagnosis of neonatal with COVID-19. From our clinical experience, the most common symptoms are fever, tachypnea, and vomiting. Different from the children and adult, the neonatal rarely present cough. Some patients develop vomiting and diarrhea, which often are resolved later. Interestingly, compared with adult, most of neonatal present normal white blood cell. Few have lymphocytopenia. Radiography findings are mostly no special. Few baby develop group glass opticity, which is also quite different from older adult patient. CT is recommended to help to confirm the diagnosis of COVID-19. But for neonatal, we are concerned about the long-term outcome of radiation exposure. With close monitoring, we found that most of the patients have favorable prognosis. Therefore, we decided to monitor radiography only by CXR. Let me introduce the diagnosis of COVID-19 in China. A suspended case about patient who have one of the epidemiologic history of meet any two of the clinical manufacturers. In the 14 days before the onset, have visited or lived in the communities with case report in the country or foreign country. Have contacted with coronavirus infected people, have contacted with patients with fever or respiratory center and other in the country.
Dr. Lee, Dr. Zeng, the system might cut us off, so try to wrap up in the next 2-3 minutes. The system may cut us off, so
okay.
My apologies.
Okay. Clinical manifestation about fever, diarrhea, cough, other respiratory symptoms, and maybe show the long emerging future. Confirmed case about suspended case with one of the pathogenic evidence. Coronavirus nucleic acid is positive in RT-PCR. Via gene screening is high homologous to the knowledge and double positive result of IgM and IgG. The IgG change from negative to positive or recovered, and 4 times a severe case about respiratory increase, and in the rest of the stage, SpO2 less than 95, and assisted breath, and so on. Critical case, respiratory failure required ventilation, shock, and combined with other organization failure. Children at high risk about contact with severe coronavirus infection patients, and a baby with underlying disease, a baby with long-term use of immunosupported, and baby under 3 months old. Warming index about tachypnea, poor mental response, and increase progressively.
We are running out of time, so maybe you have to skip that part and conclude.
Okay. We should monitor and follow up, close monitor of cardiorespiratory state, and close follow up of the chest radiography. And the newborn with middle symptoms will manage with routine care and their own health and discharged. Newborn will still have baby with underlying disease, present with severe respiratory illness, baby girl with premature asphyxia and sepsis. And he is recovered after ventilation, inotropic drugs, and fluid management. Antiviral agent, we don't use antiviral agents except neither alpha interferon, because the the use of antiviral remains controversial. Antibiotic agent only used to the conformed bacteria infection, and there are some respiratory treatment to severe case, and the end is how to manage the neonatal born to mother with COVID-19. The neonatal born to affected mother are at high risk of COVID-19. Baby should isolate and feed by formula initially until the affected mother tests negative for SARS-CoV-2. And in the delivery room, negative pressure ward isolation ward should be used. Addition precaution should be used when we do the neonatal resuscitation. To do the intubate, we need to use the positive pressure mask. Sure, we should have discharge critical. It's critical to decide the discharge time. Current criteria is stable with normal temperature for more than 3 days and normal CXR. Two consecutive results show negative for SARS-CoV-2 with upper air specimen with at least 22 hours interval. And discharge play, when the baby is discharged, we suggest another 14 days isolation and after 2 or 4 weeks follow-up. We offer the appropriate education to parents about hygiene and disinfection of the children waste at home. Thank you for your attention. That's all.
Thank you again so much. This was very well attended, and I declare this closed. Thank you so much, the colleagues from China. Thank you so much, the partners development on the South to South activity. Thank you so much. We close the webinar.